Hello, I'm going to present the project Introduction of Menstrual Product Innovations in High Severity Settings. And this is joint work with Silvia Castro, Kristina Czura, and Khalid. We collaborated for this project with Oxfam and Remy and gratefully acknowledge financial support from ERA. There are 60 million women worldwide living in displacement, and often in conditions where even the basics for managing menstruation are missing. They lack, for example, access to safe products, clean water, and private spaces. And this is not just uncomfortable, it also may pose health risks and reinforce menstrual stigma. New innovative solutions exist. But despite the scale of the problem, rigorous evidence and quantitative data on which products women in high severity settings actually prefer and what shapes whether they use them is often missing. And the barriers for adoption are often not just technical or logistical, but social. Household dynamics, and especially the influence of men, may play a role on whether women can manage their menstruation with dignity. So without better data on preferences and these dynamics, NGOs and policymakers may struggle to find the right products and design effective context-sensitive interventions. So what we did is we conducted a quantitative data collection with 750 displaced women in Central African Republic, Somalia, and Mali. We split our analysis into two parts, and due to time constraints in this presentation, I will mainly focus on the first part. In this, we introduced an innovative menstrual health kit and then measured over time product usage, preferences, and women's well-being, and complementarily assessed the social acceptability of products and social activities. Whereas this is a simple before and after design that does not allow for any causal claims, in the second part of the analysis, we leveraged a randomized design and tested if awareness sessions with men improve women's well-being and product use. So to give you some more details on the design of this first part of the analysis, in May 2024, we conducted a baseline survey with all of the 750 women. And then in June and July 2024, we conducted group sessions where we distributed the menstrual health kit, and women received explanations on how to use the product, how to maintain it, and what are good hygiene practices. Then in October and November 2024, we went back to all of these women and conducted an endline survey. But to be clear, we cannot attribute changes in answers over time causally to our intervention. There may be many factors that may influence outcomes over time that are not related to the distribution of this menstrual health kit. So it might be, for example, that participants answer differently at endline because of seasonal or social factors, and without an appropriate control group, we are not able to isolate these effects. Moreover, simply conducting a survey may already alter the perceptions of participants. And lastly, there may be experimental demand effects where individuals answer in ways they believe we expect them to answer. To give you an overview on the menstrual health kit that we distributed, that was provided by Remy. So each woman in our sample received 4 pieces of high-quality antibacterial menstrual underwear. They also received a washing bag where the menstrual product, water, and soap can be put into and then scrubbed from the outside without touching the menstrual product. And lastly, each woman received a drying bag that can be hung over the menstrual product to dry it discreetly. With that being explained, let me jump into the results. So on the following slides, you will always see the results from the baseline survey in green and the results from the endline survey in blue. First, let's look at self-reported product usage. And what we can see here is that at baseline, most women reported using menstrual cloth as their menstrual product. And this is despite all of the hygiene challenges that we know, right? Then at end line, we can see that almost all women report using menstrual underwear. So, while of course it would be interesting to also look at long-term usage patterns, we think that this already shows us a meaningful pattern of uptake, since between the distribution and the end-line survey, there were a few months time and a few menstrual cycles that women could test the menstrual underwear. So then next, we asked women which menstrual product they would prefer in the absence of any money and availability concerns. The first thing that is interesting to see is that although most women at baseline reported using cloth, actually very few women prefer it as a menstrual product. So this confirms that cloth is rather a choice out of necessity and not out of preference. The second thing that is interesting to see is that even before testing the product, many women had a positive picture of menstrual underwear, and that this increased actually after having tested the product. So at end line, nearly all of the participants report menstrual underwear as their preferred product. Then the next question that we asked was what are for women the most important characteristics in a menstrual product? So kind of now more in an abstract way. We don't refer to menstrual underwear here, but menstrual products in general. And we can see that at baseline, nearly half of the respondents name affordability as their top priority. And this shifts at end line, and nearly 60% now report that absorptive capacity, so some form of quality, is the most important characteristic for them. And one way on how one could interpret this is that after having had the chance to test a high quality product, women now put more emphasis on the quality or value quality more, and actually become less sensitive to the price. As I said in the beginning, we were also interested in the social barriers for adoption. So one thing that we asked the women is what they think how socially acceptable other people in the village campsite where they reside find using the products that we distributed. And what we can see is that actually already at baseline, women reported that they think that others view menstrual underwear as relatively socially acceptable. And at end line, these perceptions increased even further. This picture is very similar if we look at the wash and drying bag. And also, this picture is quite consistent across all of the 3 countries. Talking about social barriers, I mentioned in the beginning that we were also really interested in the role of men. So we conducted awareness sessions for men in Mali and CAR, not in Somalia. And how we proceeded here was that we asked female participants to give consent and choose one family member or one household member that is a man to join the awareness sessions. We then invited a random subset of these men. And how these sessions looked like is that there were only men present. They lasted around 90 minutes and focused on dispelling misconceptions and addressing potential stigmas around menstruation. We also conducted a baseline and endline survey with these men, and I would like to show you one result from this. And there we asked men how often they show empathy and help with household chores when women in their household are menstruating. So let me be clear that this is self-reported behavior by these men. What we can see is that at end line, significantly more men report showing empathy towards helping women towards women and helping women with their household chores. Interestingly, this is true for both men who did and did not attend the awareness sessions. So these sessions seem to have had no effect. We are in the process of now finding out why this could be the case. And we also work on analyzing the effect on the women in our main sample. Would be very happy to report at the next EHF what we found. So let me conclude. We conducted a quantitative data collection to understand women's product preferences and the role of household dynamics in shaping adoption across humanitarian contexts. We find we find that women prefer ex ante an innovative menstrual product, menstrual underwear, and continue to do so after a few cycles of use. We also find that products in the menstrual health kit are already at baseline regarded as socially appropriate, and even more so at endline. I repeat here that these effects are based on a simple before and after design and therefore cannot be causally interpreted. At endline, we find we then also conducted menstrual health awareness sessions with men and find that men self-reported more empathy and support for menstruating women at endline. However, this was independent of whether they attended these sessions or not, suggesting that there is no effect of these awareness sessions. And with that, I would like to conclude and thank you for your attention.